please don't leave unless you sign the Make It Count petition.
Yeah.
Don't leave. I would also start by acknowledging that we're on unceded Coast Salish territories. These are the lands of the Musqueam, Tsleil-Waututh, and Squamish people. I also join all of you in giving our thanks to the traditional hosts of these lands. Anyone here from any of those territories? Anyone here from these territories, rather, not those territories? So in terms of Sanctuary City, I'm just gonna pick up where Gil and Alejandra left off. And also thank you all for being here, by the way. There's so many amazing folks in the room. Lots of folks with lots of experience and knowledge in this movement. And also, I hope they won't be embarrassed that I'm going to do this, but I want to show some love to Carla and Agnes who are here, who are two refugee families who've been fighting and have won over the past few years. So in the spirit of acknowledging the kinds of fights that people are leading, there are so many of which are public and many of which are not. And just that, you know, two of you and many others are the reasons that so many of us stand here and support these struggles. For me, Sanctuary City, it's interesting, is somewhat personal as well, because when I think about a lot of stories related to access are actually around health, right? It's not the only issue, but so much of them are around health. Maybe this is also because I'm looking right at Agnes. But around 10 years ago, I was actually living with precarious legal status for years and was going through cancer treatments and had to rely almost entirely on a health system that wouldn't give me access. And pretty much relied on oncologists as well as an amazing network of people outside of the hospital system, on traditional healers, particularly from indigenous territories and various indigenous nations, who helped kind of heal me. So for me, Sanctuary City is also a really kind of personal concept in terms of knowing what it means to live without access to those things that most people take for granted, right? So Sanctuary City, and I think this is kind of what we're touching on, is that it's two things, right? So there's one which is the policy level, which is what people are just starting to talk about because of what's happened in Toronto. But there's also Sanctuary City, which is a basis from which to organize and a basis from which to help people understand the idea that so many people live without access to really basic things. And that can come from policy, but I would agree that that doesn't really come from policy, right? All policy does is provide a framework from which to understand the ways in which these things might be implemented. But really, if we look at the Toronto example, the kind of power behind Sanctuary City didn't come this past year. The power that's been behind Sanctuary City has been, as was talked about in the intro, organizing that eventually led to City Council. It's kind of funny because I remember in Toronto when Sanctuary City was even put forward as a motion, it didn't come from any of the organizers. It came from a number of service providers that a bunch of community organizers had worked with over time. And the service providers happened to know a couple of people within the city who happened to be sympathetic. So it was this thing that was really parallel to what was actually happening on the ground, right? So that's really important to understand, because the goal of Sanctuary City wasn't necessarily to get a city council motion passed. It was, if you look at any of the history of the organizing, if you look at the interviews, there's great videos online around education on deportation, which was specifically with high school students and community organizers. If you look at the Shelter Sanctuary Status campaign, which was specifically around women's centers and women's shelters, those are all about organizing from the ground up, and very explicitly about organizing from the ground up, right? So I'm just going to talk a little bit about the history, and then I want to talk a little bit about what it might look like in Vancouver. I'm pregnant, it makes me very out of breath. I can't breathe. In 2004, there was a massive campaign, a conference, and a gathering in 2004 that happened in Toronto. And that was the National Status Conference, and Harshia and I were at it, and McKean, I don't know if they're here, but that gathered around the idea that at the time there was a push to call for a regularization campaign, which is the idea of status for all. And there's 13 principles developed, which is that, looking at the lack of status across different kind of quote-unquote communities, right? So non-status folks, temporary workers, people who were permanent residents but were facing security issues. There was a range of people with precarious status in Canada 10 years ago, and still obviously are, and is just only increasing. And at the time, these 13 principles were adopted. And a big part of that, coming from migrant communities, was one of the main principles was not having access, right? So not having access to food, not having access to victim services, not having access to hospitals, so not having all of these kinds of basic access needs that we've been talking about. And at the time, and this continues today, over 60% of Canada's, quote unquote, undocumented population lives in Toronto. So out of the estimated 800,000 undocumented people in Canada, over 300 to 500,000 of them live in Toronto, right? So that was most acute in the Toronto area. And after that, it's Montreal, and then it's Vancouver. Vancouver actually has less than 5 to 10%, so it's kind of interesting that for such a large city. It's obviously growing now, particularly with the increase around a number of changes, including the increase in temporary workers. But for a long time, that was kind of the demographic. So in Toronto, the idea was to take these 13 principles of regularization and build them from the ground up, right? Like knowing that the government, no matter whether it's NDP or Liberal or Conservative, is not going to grant people status. And in the meantime, people are living in such precarious situations. So not only are you living with fear of detention and deportation, you're living without these daily access needs. And so the two things that kind of sparked it over the years was raids that happened in a school. So I won't go into the whole history, people can look into it. But there were actual incidents that basically triggered people into kind of activating these responses around these campaigns. And the thing that's really important to realize is, so the Education on Deportation campaign was led by community organizers as well as students in those specific schools where these raids were happening, where these students were basically taken as bait and put into detention in order for their parents to come out of hiding, right? And in terms of the Shelter Sanctuary Status campaign, this was organized around women's centers because women who were trying to report domestic violence and forms of intimate violence were facing deportation when they went to try to report. And I do want to say the one thing about the Sanctuary Shelter Status campaign, and I can kind of echo, this has been my experience informally in terms of working in a women's center in Vancouver, is that there's actually, one would think that women's centers would be allies in this fight, and that's not always the case. So in Toronto, it was actually an uphill battle to get a number of women's centers to adopt a policy where they wouldn't ask for status when women came to their doors, right? There was actually a number of EDs, executive directors of women's centers, like supposedly progressive women's centers, who would say pretty racist things. Like, if we have this policy, then suddenly we're gonna be flooded with numbers of women who are undocumented, right? And that's kind of what Canada says as a government. Like, we can't really deal with this flood of undocumented people. So they were using the same kind of racist logic. And in Vancouver, working in women's centers, when we do referrals, there's actually quite a number. There's a number that don't, but there are a number of women's centers who will ask about the status of women in need of services, right? So there's actually been an increasing amount of work done informally in Vancouver, particularly amongst the network of women's centers and rape crisis centers, to say, that's kind of a fucked up question to ask, right? Like, that is not the mandate. The mandate is to protect women, to protect all women, and to be inclusive to women's experiences. It really shouldn't matter why someone or who they are when they're accessing your services. So, in terms of what a sanctuary city would look like in Vancouver, I mean, obviously it's so necessary, but I do think, as people have said, I don't think it would be about importing a policy, right? It's about how do we build these from the ground up? How do we, each of us could be involved in building a sanctuary city. Any community center that we access, we can find out whether undocumented people can access those community centers, right? A lot of times you actually can't get membership cards to certain community centers because even though they're not supposed to, they all have different policies. A number of community centers will often ask for people's SIN numbers, for example, right? And some don't. So trying to find out what those sites of access are, even in our own neighborhoods. If we work in schools, trying to find out what the school policies are. It's constantly changing. There's been so many students and parents who've been told that they have to show documentation that their kids are living in Canada legally, even though when you talk to various school boards, the school boards will deny that that's their policy, right? And so a big part of Sanctuary City is making sure that the spaces that we access are safer, and that doesn't happen from a policy. That happens from us building and creating those spaces and making sure that, for example, women's centers are trained to not ask those questions, right? That part of the orientation of staff is that that can't be asked. And the reasons why, right? Why this is politically important. What is the message that we're trying to send when we're saying that all services should be inclusive to all people? Because that's really the idea behind access, not fear, right? Or access without fear. Is the idea that all of the spaces that we take for granted within our communities should be accessible to all people. And at one time, that was a fight within the progressive movement. If we look at the beginning of women's centers, they weren't bureaucracies that they are now. They were started by grassroots people. So part of this fight is also to reclaim those spaces and those institutions that actually come from within the movement, right? But that have kind of gone elsewhere. And so I think that's a big part. And particularly in Vancouver, there's a lot of links that we can make within struggles in the downtown east side or with struggles in the downtown east side, because that is a community that has fought for access despite also high levels of criminalization, right? If we look at the history of places like Insight, if we continue to look at health centers in the downtown east side, they continue to have some of the most radical policies as healthcare workers because people are politicized into knowing that when you're providing access in certain communities and certain neighborhoods, you're dealing with high levels of marginalization and criminalization, right? So there's a lot that can be drawn in terms of building links. And also with a number of Indigenous communities. So I know a lot of Indigenous folks who don't register their children under the Indian Act because that's their act of sovereignty. And it's actually really interesting to see that a lot of them, when they come into the city and they ask us, you know, how can we get healthcare because we actually need healthcare but our kids aren't registered, they're actually accessing a lot of the support services that non-status and refugee communities are accessing, right? They're accessing some of those clinics. And so there, in terms of understanding Sanctuary City as access for all people, there's also a lot of other kinds of links that we can draw in terms of folks who aren't getting access to these services, either because the state denies them or because at the end of the day, we're trying to subvert all of these state systems at some level, right? So how can we also be building institutions that are outside the purview of the state? Obviously, some are harder than others. Healthcare is a lot harder than some things, but how are we creating zones of access that people can have access to? And it kind of comes back in some ways, it's interesting, because the idea of Sanctuary City came about because of churches giving sanctuary, right? And so right now, Jose Figueroa, for example, has just taken sanctuary in a church. So that is also a form of a solidarity zone, right? Saying, we don't want this person to be deported. This person is a part of our community. What are we going to do to ensure that they are safe and that they're able to live freely, they're able to live with some level of dignity outside of the reach of CBSA? And especially with increasing enforcement, which has become kind of the main thing, like enforcement, you know, the number of raids, the number of deportations, the number of detentions is increasing. We have to think not only about a sanctuary city, which is the last thing I'll say, we also have to think about how are we actually going to stop detentions and deportations? Because a sanctuary city is inadequate if very soon the number of people who are being deported will increase far beyond the number of people who need a sanctuary zone, right? So we also need to be thinking about how are we going to fight so people can stay here? Not only how can people live with dignity until they're in detention or deportation. And so I just want to end by saying I think the fight to end detentions and deportations and status for all really has to be at the center of what a sanctuary city looks like, and that access, not fear, is a way to ensure that we're getting there in the meantime, if that makes sense. Thank you.